Welcome to Dr. Balga's podcast for the Curious Doc. Today is 6 February 2026. This video is on a Lancet article published online on January 29th, 2026, open access last week, titled Prediction of Mortality, Bleeding and Ischemic Events in Patients with Cancer and Acute Coronary Syndromes, a model development and validation study. Patients with cancer presenting with ACS face competing risks of death, bleeding, and ischemic events, and existing risk scores exclude cancer-specific factors. Methods for model development and validation study used national registries from the UK, Sweden, and Switzerland. Sample size 1,017,759 ACS patients and 47,236 with cancer. Follow-up 6 months after ACS admission, median age 76 years, approximately 70% were male. There was broad tumor representation. They used AI with competing risk modeling. What did they find? The 6-month cumulative incidence, mortality was 27.8%, major bleeding 7.3%, ischemic events 16.1%. The model performance was 0.84 for mortality, 0.70 for bleeding, and 0.79 for ischemic events with robust external validation. Risk gradients, very high risk group mortality hazard ratio 90.4 versus low risk, p-value less than 0.0001. Limitations of the study, this was an observational registry design, residual confounding, limited ethnicity data outside the UK. Key takeaways: cancer-specific ONCO-ACS risk stratification enables balanced, personalized ACS management. This is the website, the ONCO-ACS.com, which shows 11 risk factors for variables. Together, these variables predict 6-month all-cause mortality, major bleeding, and ischemic events. The accompanying commentary from Sloan Kettering, authors of Sloan Kettering, commented that this highlights ONCO-ACS as the first cancer-specific, externally validated risk score, integrating these routinely available variables to predict 6-month mortality, major bleeding, and ischemic events, outperforming GRACE, Paris, and PRECISE DAPT registries. More than half of the cancer ACS patients are classified as high or very high risk across competing outcomes, underscoring the need for nuanced trade-offs between invasive strategies, antiplatelet intensity, and duration of dual antiplatelet therapy within multidisciplinary cardio-oncology care. Caveats: generalizability beyond the European cohorts is uncertain, and the absence of platelet counts and active therapy data limits real-world precision, according to the authors of the editorial. The key take-home message: ONCO-ACS is a decisive step towards precision cardiovascular care and oncology, best used to complement, not replace, guideline-directed management, but paving the way for prospective trials. Clinical pearls: cancer substantially alters traditional ACS risk predictors. Simultaneous prediction of mortality, bleeding, and ischemia improves therapeutic decisions. Most cancer patients with ACS remain candidates for invasive strategies when the risk is appropriately stratified. This is more about the competing risk modeling. Hit pause and read at your leisure. The eponyms mentioned in this study are the GRACE, PRECISE, DAPT, and Paris score. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.